Okay, so I have two important announcements to make before we start. The first one is in case you haven't received your t-shirt yet, don't worry. After the sessions, we're gonna give them away. And the second is that we have a birthday today. So, Julia, if you could stand up. And on the count of three, I want every and each of us, guys. Okay, so on the count of three, I want every and each of us sing in our own language. Happy birthday to her. Okay? Are you guys ready for that? Okay. Joe, are you recording? Okay. 1, 2, 3, go. Parabéns pra você nessa data querida. Muitas felicidades, muitos anos de vida. Happy birthday, dear Julia.
Not fair, Bruno. You were using the microphone. We could only hear you. Okay, so we have a session now about advocacy. We're going to continue in with what we had been already starting discussing this morning. And we have a guest with us that is going to be speaking about the global network of parliamentarians for diabetes. His name is Adrian Sanders, and well, he's going to tell you more.
Can I follow this just to speak? Yeah. Okay. Well, good afternoon, everyone. You heard this morning from Bruce Taylor and my namesake, Adrian Gut, about advocacy, and that's basically what the Global Network of Parliamentarians for Diabetes is. We are a group who are dedicated to ensuring that governments take diabetes seriously, prevention, early diagnosis, and the best treatments wherever anyone lives. And that's critically important. We have a network of parliamentarians in around 71 different countries. They subscribe to a newsletter, which doesn't cost them anything. They just fill in a form and they go on the mailing list. And that newsletter is full of advocacy ideas, questions to raise in Parliament, legislation that they could try and pass, and indeed amendments to legislation that's already taking place. Now, in some respects, you guys as advocates would probably find our newsletter interesting from the point of view of giving you advocacy ideas that you could try out in your own countries. But the thing that I would really like, if you were able, is to contact your elected representative. Some of you might not be of voting age, I don't know. But whether you are or not, you will still be represented by somebody in your area who is a legislator. And they depend on the people who have votes at the moment and the people who will have votes in the future. They work for you, or they should work for you. And you can make them work for you simply by approaching them. And you'd be surprised how scared parliamentarians are when a young person approaches them. I know that as I was 18 years a member of Parliament in the United Kingdom. And if a young person showed the courage to come and talk to me, I listened. And I can tell you now that a face-to-face, in the eyes of a parliamentarian, is probably 10 times better than a phone call, 100 times better than a letter, 1,000 times more effective than an email, and 100,000 times more effective than a petition. Face-to-face really does concentrate the mind of a parliamentarian who wants your vote in the future. So, how do you approach a parliamentarian? It's actually quite easy. You should find their contact details in a phone book or online, more likely in this day and age. And you pester their office for an appointment. You pester them to have a meeting. And when you get to have that meeting, you need, as Bruce said this morning, to have an ask. You need to know what you're going to ask of them. Now that ask could be as simple as saying, please would you take diabetes more seriously, or start to take it seriously, and join the network of parliamentarians so you can be even more effective on my behalf, to an actual ask of a piece of legislation or reimbursement for something, or for having some form of technology more freely or more widely available than it is at the moment. So my message is really quite simple. Don't be scared at going forward. Don't be frightened of politicians. They work for you. And if you want, from our web address, sign up, send me an email, and I'll make sure you get the newsletter. And so once a quarter, you'll get something in your inbox with ideas. They won't all be appropriate to your circumstances, but within there may be a little nugget that actually suggests this is something I can get engaged with, ask my elected representative to do, and who knows what that can lead to. And if you ever think one person can't do anything, well, just remember, from an acorn, an oak tree grows. You are acorns. Make sure you become oak trees with your advocacy.
Working now. Sorry about that. Yes, we're going to move now to the session on advocacy, and we're going to be joined in this session by Mark. So, Mark, you have already introduced yourself, I think, right? Okay, you have the microphone there. And we're going to be talking about translating international commitments to national policy. So this is something that we started already talking about this morning, how important it is. Nothing happens if it doesn't happen at the national level. Let's go for the global diabetes commitments. You want to go ahead, Bruno?
Sure. So I'm gonna just mention them really briefly because James, Ida, and Bianca, I think cover, if not all of them, most of them. So when advocating for diabetes, and this we can discuss later, but sometimes it's more strategical to address the NCDs targets than just the diabetes. This will change from the forum. This will change on the topic, but it's relevant, and you know that sometimes they just put all the NCDs in the same pool and they treat us as the other NCDs. But sometimes this is relevant for us. So these are two targets that it's relevant for you to keep in mind. So the zero increase in obesity and diabetes for 2025, and the 80% access to essential medicines and device, which diabetes, again, it's included. The global diabetes targets, I won't mention them again since Bianca and James talked about them early this morning. And also the Global Diabetes Compact, which is a framework for action in the prevention and management of diabetes. And on that framework, as earlier stated by our WHO colleagues, there's one of the topics that mention meaningful involvement of people living with diabetes. So other than all these global commitments, within the global commitments, there are like specific topics that you can refer to depending on what you're advocating for.
So, what we were saying this morning, international commitments are needed, but nothing will change without action at the national level. And that's what we want to be talking about. So we are going to present to you 10 steps, which are in this document that we have shared with you. So all of you should have one. And if you don't, just raise your hands, and Daisy will be distributing a couple more. Okay, so this is a document that IDF developed about a year ago. So it's called IDF Guide to Data-Driven Advocacy. We were saying this morning how important is evidence and using figures to support your request to governments. So we put together this document that has 10 steps, and we are going to go through each of them. We develop this type of documents quite frequently. You are going to see some familiar people in here. We always try to include messages from people living with diabetes in our materials. And actually, I think it's the first time that all the pictures that are included in this document are of people living with diabetes. So we organized a few photo shoots. And yes, we're very happy with the result. Actually, we have young leaders at the back from the Busan training. You will be appearing in future documents like these ones. So yeah, just to warn you about this. So we're going to go through the different steps. We haven't really had the time with everything that happened yesterday. We wanted to have a bit more time to prepare, but we are going to have to improvise a bit. So Mark, what do you think about we do one, each of us? Okay. Yeah, yeah. And each of us will be doing one step. Okay, I will start with the first one because actually we have already discussed that a bit. So, understanding the importance of data. Before actually looking for the evidence that you need to understand why this is important. This is essential background information. Without these figures, no one is going to be listening to you. It helps put the issues of the problem of diabetes in your country, what we were talking about this moment, in context. And there is a problem in many countries because we do not have reliable data, and that doesn't allow us actually to measure progress on diabetes. Without data, we cannot know if we are improving, where we are going, so it's super important that we have this information. To the second.
Well, I think this is related to the previous one, and that's true, as we have discussed, earlier today, that most of the countries actually don't have registries. But anyway, there is somewhere to go for some data. So even though they are estimations, but they are, the best we have for now. So we encourage you to use the Diabetes Atlas data, as well as the T1D index. There is very new, just released, and bring some extra data on type 1 diabetes, right?
And then we would say that you need to identify the priorities and set your goals. So just to give you an example, yesterday when we were talking about like the issues that children living with diabetes, there were like at least mentioned 4 or 5 priorities. In the ideal world, people or decision makers, policy makers will care only about diabetes, but that's not the reality. So we need to make choices. So in the end, what is your ask? What you want to achieve? This change that you want to achieve involves local or national or regional policies. I know this differs from country to country and from region to region, but you need to understand who is the decision maker in power of that law or that resolution. Second, third, is there any data indicating the change that you want to achieve is cost effective for the healthcare budgets, and we can go even beyond. Is there, for example, bringing back to the schools, is there any evidence that shows what is the impact on the learning development of a hypoglycemia? Is there any data that indicates the impact of the bullying that have on on learning, for instance. So you need to dig and go for those data and for the information that you need to specifically solve the problem that you want. And the fourth topic on this step, well, what's your capacity to generate change? As we said, we don't need at first to try to change something at the global level, and neither in the national level. It's fine to become or to start step by step. So it's fine if you want first, perhaps you try to change the school you attended bylaws so they can guarantee some sort of like diabetes education. So of course, being ambitious is good, but also it's important to be realistic.
Can I make two comments only? So one thing that I would add to this slide is, first of all, if you are advocating for something, make sure you know what you are proposing. Because I believe that this is one of the biggest mistake of advocates, when they go only to complain and they have nothing to propose. So this is one of the things. The other thing is your capacity to generate change. So don't forget that you have your association as well. You have probably many people with you already. So, but maybe not everybody is seeing what needs to be, changed, and you'd be an important part of, the group to inform your member association and to be with them and to maybe make a national change. Why not?
Okay, so we move then to step 4. Identify your target audience. So who are you going to talk to? Depending on who you talk to, you are going to have to use one message or another. So first of all, you need to scan the environment to identify who is important to you. There are going to be different people at different levels, so probably you don't need to go to the Minister of Health directly because they are not going to listen to you, but maybe you can start with the person in charge of health in your community, in your city, in your region. There are 2 different types of stakeholders. We normally divide them in primary decision makers, so those are the ones who generate the change. So normally parliamentarians, governments, ministries, and then we have influencers. So those are the ones who do not generate change, but can influence on the people who generate the change. It's sometimes a bit difficult to reach out to the primary decision makers, but it's sometimes easier to go to the influencers. So one thing that you can do is try to focus on that group, so you can indirectly influence on the primary decision maker. And another thing that you can do, and you have actually an explanation on how to do it in the document that we have shared with you, is creating a power map. You need to make a list of everyone who can help you on the matter that you want to improve. And then you need to check, okay, can this person help me? Who is the person that is going to help me more? Who is the person that has more power to change this? Who is the person that I can access more easily? And then you can prioritize who you want to reach out, because unfortunately resources are not unlimited, and time is one resource that is very limited. So you need to focus your efforts on what is going to yield better results.
Well, I think here is this one also dialogues with the beginning of, you are diabetes, but diabetes sometimes can go together to, fight for something with the cancer organization, with the hypertension organization, with different other conditions, especially if non-communicable diseases, right? So that would be giving you extra power to fight for something. And obviously there are other partners that you find key in this, in this fight.
So define your objectives and plan your strategy. Again, as mentioned before, we like to be ambitious, but we need to be realistic. So we need, and we really recommend you to plan different phases for your advocacy project, your advocacy initiative. And for that, you need to develop smart objectives. So don't worry that we cover about smart objectives tomorrow, and you have the time to learn more. Sorry, I have a hypo.
Okay, sit down. I think Mark and we can take care of it. You're going to love the SMART objectives, guy. Very easy to get. So step 7, develop your advocacy messages. So we were talking before about identifying the people that you're going to talk to. So also when you develop your messages, you need to think about who are you talking to. The response from your audience is going to depend on how good the message is. If you go to them with a message that is, you don't use really good evidence, your request is not clear, as Mark was saying, you just go to complain and not to offer a solution, they are not going to listen to you, or they are just not going to make you as much attention as if you go with a clear request. A good message needs to be easy to understand and to remember, so something short, something that is catchy. And you have to mention in a good message, what is the problem? What do you want from your audience? Because sometimes, yeah, you know what is needed, but you are not clearly expressing it. And that's a problem because your audience is not going to know what they have to do, what you are expecting from them. You need to also mention why that change is needed, what is the benefit from your target audience of actually implementing that change. And then you also need to mention by when, and this is something that a lot of people forget. You need to say the deadline, okay, you need to do this by the end of the year, by World Diabetes Day, we are expecting this from you. By 2025, we want this to happen.
Okay, the message again. How many of you have trained the elevator speech before coming? 1, 2, 3, 4. Yeah, not. In general, yeah. To introduce yourself, talk where you are from, the association, etc. So some of you. So excellent. So that's my advice for this. So train the elevator speech and go online. There are many examples. There are many ways of training because usually you just meet a person, meet a decision maker, and you need to be very fast and to quickly convince and share your contacts and then if you are convincing, then probably you'll be contacted or not, and then you insist. Okay, but you need to be prepared. That's important.
And right after this session, we're going to have a session on storytelling. So definitely this will help you on developing or even improving your elevator speeches. Okay, too many bullet points for a hypo. Yeah, you can go.
Come on, but if you do not feel well, yeah, okay. So the step 9, implement the advocacy strategy. So once you have done all this scan, you have put together your advocacy message, you have identified the people you want to reach to, you need to start actually the implementation. So you need to learn how to prioritize, and tomorrow the young leaders who have already developed the projects are going to tell you about that. You are not going to be able to do everything that is in your head, so you really need to see, okay, what is the thing that is more important to start by. For each SMART objective that you will put together, you will probably need to develop more than one activity. You need to integrate also online and offline activities as much as possible to reach a wider audience. Also, we have a few experts here on social media. We're going to have a session tomorrow on how to use social media for your projects to boost the reach of your activities. So really integrate that, because also social media is for free and you can reach a lot of people that you will not reach if you do not use it. You need to set a timeline. This is also related to prioritizing, so what are you going to do first? But really, it's super important that you have all of this in writing, because seeing that is going to help you see, okay, I'm late on this activity, or this thing I'm going to have to drop it because it's not a priority anymore, or the situation has changed and I need to adapt what I need to do. If you have a team, and ideally you will not be working alone, you need to assign responsibilities. So who is going to do what? If you do not do this, some people may be working on the same thing and you are losing precious time that you can dedicate to something else. And another thing that also the young leaders are going to tell us about tomorrow, you need to assess the challenges and the risks. So there are things that are going to happen. And again, for the last young leaders, we had this meeting in 2019. Everyone had a beautiful project in their head. And then in 2020, COVID happened, and probably none of them could develop the project that they wanted because of that situation. So obviously we are not asking you to plan for, okay, what happens if there is another pandemic, but you need to bear in mind that there are things that could happen, and you need to plan, what can we do, what can I do with my project if this happens? What else can I do to adapt it?
Okay. Here, measure the results and report progress. Obviously, this is, well, most of the time forgotten, to say the truth. So usually only if there is a big change, a national change, then you see the change, but you don't monitor and you know, your activities, and this may make the hard to plan the next step if you don't monitor, right? I'm not reading the things. I'm kind of going quickly, if you don't mind. So I think, because I think the guide is wonderful and self-explanatory, and the last pages also are super useful, because you have here all the steps, etc. So that's why I'm not stopping to say, and I'm probably this is the last step, the 10th step. So before then moving on, I'd like to say two things. One of the things is, if you are doing an advocacy activity in your country, please share with me. I love to know about what is happening, and I learn with each different activity, different achievement there is made in the different countries. So for example, this year I learned a lot from Uruguay and from Australia. Is there anybody from Uruguay and from Australia here? Yeah, great. So they made some super big progresses through advocacy and through very similar strategies. So congratulations. And and I'm sure that many of you have also, but you haven't shared with me yet, but hope you soon share with me. And the other thing is that I know that you have more cooler and nicer t-shirts, but I also brought two for a raffle. I don't know how Beatrice and Bruno would do. So if you are from the camps, if you participate in camps, etc., you know that it's very usual to have the camps t-shirts. And when you visit another camp, you bring the t-shirt of your camp as a gift. So in Brazil, we have diabetes camps for more than 40 years now. So this is the t-shirt of our camp in Brazil. And obviously, this is not exactly of our camp, but anyway.
Okay, so these are the 10 steps. Really, this one is super important. Mark was saying that no one really monitors progress, and if you do not do it, you are not going to know where you are going. And you need to let us know also what you're doing. So every 3 months, we're going to be like, hey, it's time for the quarterly report. It's going to be Inés, you're laughing. It's annoying when we do that, but really it's super important for us to know what you are doing, but also for you, like, okay, every 3 months you're going to reflect on what you have been doing, and when you put all of that in writing, actually it's going to help you. Okay, maybe next quarter I'm going to have to change this or that, yeah, that's going to be very, very helpful for you. So we have, let me check, what time is it? We have 55 minutes now for a workshop on all the steps that we have been discussing. Mark, I don't know, you are one of the people with the most experience in advocacy that we know. Is there anything else that you want to say about your experience in advocacy, about these steps before we start with the workshop?
Well, the only thing I would add is there is no one single formula. So, you know, you need to to be creative and to really try and identify what are the so the hints there that what would work best in your case to make the change. Okay, and I don't know.
And if
probably
you allow me to just add something, of course you need to shape and adapt whatever works for the reality of your city, region, state, country. But advocacy, and back to the conversation that we had, what's advocacy and what's not advocacy, an advocacy involves strategy. So whatever steps or whatever strategy that you decide to follow, it's important that you follow any strategy. It's not just like get going and like figure it out by the as the things go. Of course, it will require a lot of flexibility, but it's important to have a plan. It's important to have a strategy. Otherwise, it's not just like a concept discussion, but it's a more practical discussion. It cannot be considered advocacy.
Thank you, Bruno. Okay, so any questions before we start with the workshop? Perfect. We have this here, some flip charts that you can use now. Yet to write down. We have some markers also at the back. You can write down, and we would like you to maybe groups of 6 people to work on this together. You go through all the different steps. And in each of the groups of 6 people, we would like that there is one returning YLD. So yeah, here there are a lot of returning, so you will have to mix with the rest of the group. But yeah, the idea is that you support the others, okay? And Mark, Bruno, and I are going to be going around the different groups.
And feel free to sit on the floor if you don't mind. Like, use the room.